I'm just so blessed and appreciative to be with you today because you all are such an inspiration. We sit in Washington hoping great things happen in the world. We advocate for policies, we raise money and give it out to great organizations. But when I can come here and listen to your stories, see the great things that you're doing, meet the people with the biggest hearts and the hardest work, it provides fuel and inspiration to me. I mean, coming here and being asked to speak is like preaching to the choir. I'm not sure if there's anything I can say today that's something that you don't know from the great work that you do each day. So thank you very much. And so as we kind of look out on my comments today, I'm going to do what my son Alex, I have 5 kids, 3, 10, 12, 15, and 17. I know you can't believe I'm old enough to have a 17-year-old. You don't have to say it. I can see it in your eyes. So Alex is a reader. And what he does, he checks out the book from the library, comes home, and he reads the last chapter every time. So I'm going to give you the last chapter of our time together. So it's 2 things. One, and this is supposed to get you interested in case you haven't figured that out. So one is knowing where people eat lunch may be the most impactful thing you can do to end childhood hunger in the United States. Okay, number 1, know where people eat lunch. Second is, I might say some things that you don't like, and I'll just apologize ahead of time. So, I always, with the 5 kids, I find myself saying a lot at the dinner table, I've got good news and I've got bad news. And then I think to myself, I sound just like my mom. So anyway, we're going to talk a little bit about the good news and bad news. And Kathy mentioned that I'm going to talk a little bit about advocacy today. So one of the very important components of advocacy is local advocacy. So I'm going to give you some very local advocacy that happens in my house. So it's usually Thursday night at dinner, and it starts with something like this from the 10-year-old. Hey, Dad, you've been cooking for weeks. Can we go out to eat or order Chinese or order pizza? And then the next day, Friday, I get a text from the older 2. Hey, Dad, can we go out to eat tonight? And then I'm on my way home on the train. I get the call from the wife. Hey, honey, why don't we order Chinese tonight so we don't have to cook, right? And believe me, that's the right person at the right time with the right message, right? The key to all advocacy. So today, I'm going to be a little bit like my kids. I'll start with the good news and say, sure, we can go out and eat Chinese. The bad news is we won't do it again for the rest of the month. So I'm going to give you the good news and the bad news of childhood hunger in the United States. So the good news is we know what works to end childhood hunger, and we are making progress in ending childhood hunger. Right here in Arkansas, you saw the maps that Dr. Gunderson, you heard the data point that we've gone from 200,000 to 175,000 food insecure children. And as a nation, we've dropped the number of children experiencing food insecurity by 1/3 since 2008. Okay, 1/3 reduction in childhood hunger since 2008. And it's good news because we know how to do it. Here's what works: the federal nutrition programs. Dr. Gunderson talked about SNAP. That's the first one. We talked about WIC. That's another one. Both those are household benefit programs. We know that programs that provide meals to kids when they're hungry, wherever they live, learn, and play, work great. the school lunch program, the school breakfast program, the after-school meals and snack program, the summer meals program, the program that reimburses child care settings for providing meals. And we know that the programs that many of you run every day, those emergency feeding programs, and let's just call it out, those are largely funded and supported by the federal government through the TFAP program, the Commodity Supplemental Food Program. So it's a lot of charity, it's also a lot of government that flows into the food banks and the food pantries. Fills in the gaps, where the federal programs. So what do we mean by these programs are working? One is we know, because of Dr. Gunderson and lots of other smart academics out there, that they reduce hunger. That's what they're intended to do. What's SNAP supposed to do? It's supposed to reduce hunger. Second thing is, many of them have demonstrated that they reduce poverty. If you want to lift people out of poverty, SNAP is one of the best ways to do that. They improve health. Again, we don't need a big research project to know if you eat healthy, if you eat well, you're going to be healthier. If you don't eat well, you're not going to be healthy, right? We know that they improve health. If you eat school breakfast, you're going to be healthier. If you participate in WIC, you're going to be healthier. If you participate in SNAP, you're going to be healthier. We've proven this over and over again. The other thing is they improve academic outcomes, something not a lot of people talk about. We were just Patty and I and Vivian were at the Department of Ed yesterday, and the first thing that we talked about was not feeding hungry kids. We talked about improving academic outcomes for children. There's a lot of ways to do that. One of the most important ways is to make sure that they get breakfast. If they need an after-school meal, to make sure they get it. The other thing is that brings money into the local economy. So, an important thing to understand that's very unique about these federal nutrition programs is that by and large, all of the funds to pay for all of the food and the meals and the admin is 100% federal. So the more kids that participate, the more federal money comes back into our economy. The more SNAP participants there are, the more money that gets spent in grocery stores. The more Arkansas farmers have groceries to sell. So if you want to drive the local economy, expanding these programs is a great way to do it. It can also be an employment program. I was out in Southwest Virginia, looks a lot like rural Arkansas, and I was talking to a food service director who started doing summer meals, after-school meals, and breakfast in the classroom. She was doing it all. Small school district, 3 schools, she ended up hiring 8 more staff people, right, to work. It was some of the best jobs in that economy because she had more federal money coming in. So imagine this. We can feed hungry kids, improve education outcomes, and hire more people, all with somebody else's money. You don't need anything from the state legislature, right? You don't need to go and hold another fundraiser, turkey dinner, none of that. So the financing works for maximizing these federal nutrition programs. They are paid for and they can grow. They also enjoy a very strong bipartisan support. We're going to talk a little bit about the threats to SNAP, which are real, and we need to advocate about those. But the child nutrition programs, for the most part, are not in anybody's crosshairs, okay, for the budget cuts. The school lunch program, which all these programs sort of sprung out from, it was started because of the trouble the military had during World War II recruiting healthy soldiers. When they went out to draft everybody, they found out that the population to serve in the Army was malnourished, right? It was a military readiness The inception of the program was around military readiness, and all these programs have really enjoyed that strong bipartisan support. So we know we can center some new strategies to expand them and have some confidence they're there. And, through the great work that we've done here in Arkansas, really the great work you all have done here in Arkansas, in addition to knowing how effective these programs are, we have learned a lot about how to manage these programs, how to operate them in a way that reduces those barriers to participation. Because the programs are there for the taking, but there's a lot of barriers in many communities for children to access them. So by learning how to do it right and getting people to change how they deliver the programs, all these good things can happen. And that's a real testimony to the great work you've done here in Arkansas. I'm going to give you a couple quick examples of how the programs need to change. The first one is the school breakfast program. And I like to say, hey, school breakfast is like a restaurant. If the restaurant is on the right corner and open at the right time and the food's pretty good, people are going to show up there and eat. But if you put that restaurant on the wrong corner and it's not open during the right hours and the food's not so good, they're not going to get much business, right? Maybe a couple people, but they're not going to get much business. And that's really the story of school breakfast as it grew up in the United States and in Arkansas. Well, we served lunch in the cafeteria. Now, it took us 5 blocks and from 10:30 to 2:30, but we managed to serve lunch in the cafeteria. So where do we serve breakfast? Well, we just serve it in the cafeteria. But guess what? It doesn't work very well for a lot of reasons. One is not everyone's getting to school before school in time to get to the cafeteria. 2, there's a stigma that's grown up that the poor kids are the kids that eat breakfast, right? They're the kids going to the cafeteria before. And then it's just a logistics problem. If you've got 5 blocks to serve lunch and you're trying to serve all those kids in 20 minutes before school, you can't really fit them all in. So when we change the model of delivery, breakfast in the classroom is the most effective. So at Share Our Strength, we give money and provide technical assistance to try to make these changes. So we have data from thousands and thousands and thousands of schools and millions of dollars, and we know exactly what's going to happen when you do it. So when you switch to breakfast in the classroom, I'm looking at my data people sent my data sheet here. When you switch to breakfast in the classroom, on average, 86% of the kids that eat lunch are going to eat breakfast. When you create what's called second chance breakfast, and this deals with sort of the problems of the morning rush and the commute, right? Second chance breakfast is when you serve breakfast between first period and second period, or if you have a homeroom block between homeroom and first period, so after the kids are already there and settled, then it goes up to 75%, right? If you combine those two, if it's second chance in the classroom, it goes even higher. So we know what works. We don't have to reinvent the wheel and test it. We have to convince people to do it. And that's, part of the message today is you may do great things every day in your food pantries and at hospitals and other places that are doing amazing work to end childhood hunger, but we have to change these models to drive down that rate of childhood hunger. We need all these programs to be working at full tilt so you have fewer lines in your pantries, right? You want to raise less money. You want to spend more time with each person and help meet all their needs, not just their food needs. The way to do that, folks, is by getting out of our boxes to these other programs and working to maximize them. And I'll talk for a couple minutes about how to do that, and then we'll ask questions. So that was the good news. The good news is Childhood hunger, going down. Why is it going down? Because we have programs that work, and we know how to make those programs work better, and we're making great progress. Bad news is we still have a long way to go. Maybe there's only 175,000 food insecure children in Arkansas. That's 175,000 too many food insecure children in Arkansas. The struggles are profound. Everybody's got a front and back of one sheet that we just did some research. You know, we talk a lot and we know a lot about kids who are in school and their experience because kids talk, and we do a lot of research in schools and got a lot of data about that. Less is known about the experience and the challenges of families with really young children. So we just got out of the field and have published a report on hunger and the experience of low-income families with young children. Couple highlights for you. One is that low-income parents worry extensively about basic needs, food and health care being at the top of the list. I was struck. I've met some really wonderful women the last 24 hours here in Arkansas who tell me about their experience doing SNAP outreach and working in pantries. And one thing that I was struck is how often healthcare and food was mentioned in the same sentence, talking about the same person and talking about their needs. Sometimes they have profound needs on both, but sometimes it's that trade-off. Well, I spent money on food, but I wasn't able to buy my medication, or I'm okay on my medication, but now I'm hungry because I don't have enough for food, or I'm worried about my rent. Right? This is what you live every day, right, folks? This is what you live every day. So really, you can look at the numbers here, but to me, Dr. Gunnarsson talked about not being surprised much. This is one of these cases where this research, I kind of thought things were bad, but I didn't think they were this bad, right? So very profound challenges. And then, we kind of dug into their experience with their ability to feed themselves and their family. And so we took some of those, Dr. Gunnarsson talked about those 18 questions. We asked a lot of those questions individually as part of this survey, and we found some really shocking results. 2 in 3 parents admit they worry about food running out before the end of the month. 42% remembered a time in the past year where they could not feed their children. And almost a third said their children were not eating enough because they couldn't afford it. These are really high numbers, higher than we see when we look at those composite food security numbers. So the needs for this population are great. And part of that is that we don't have that anchor institution like we do for school-age kids. We know during the school year how we can reach kids, and we ask schools to do more and more things. But before they get to school, you might think, well, we'll just hit all the Head Starts and all the child care centers. Guess what? 90% of low-income kids are not in any kind of child care setting and won't be over the course of their first 5 years. These kids are in their homes, their grandma's home, their cousin's home, home of a friend through informal care, neighbors pooling their resources. These kids are at home. So when we talk about how we reach them and what's important, SNAP and WIC are the big tickets in town. So those programs have to do a better job. And in particular, the WIC program is great 0 to 1, right? We just had that conversation. It is not so great starting at the age of 1. So finding ways to work with our WIC clinics, to do outreach in your pantries with families, with young kids, and talk to them about WIC and the value and trying to get them hooked up with that program. There's a lot of great SNAP outreach out there. Nobody's talking about WIC outreach, and we need to do WIC outreach for all those families because these problems here are profound. And you can see if you flip that sheet over, you can see the programs that they value and rely on. And those programs, the first one on that list is SNAP. Can't let anything happen to it. So, it's tough for all kids. I think it's especially tough when we don't have that place called school where we can anchor all of our interventions. The second thing is, while we are doing great, and let me tell you, Arkansas is a leader in the nation, and it's because of hard work. You're one of the top in breakfast, and something we don't talk as much about, you're one of the top in after-school meals and snacks too, Kathy. I mean, you are like fourth in the nation in after-school meals and snacks. It's right around 20%. So, but lots of room to grow. It's a relatively new program, lots of room to grow. So there's great success, but not enough success. So missed opportunity. You have about 64% of the kids that are eating lunch are eating breakfast, 20% eating an after-school meal or a snack. And in the summer, it's just miserable for kids. They're hungry, they're isolated, they're at home. Last year, you served about 2.3 million meals in Arkansas. You have to at least double that to start making a substantial difference, right? We need to, at a minimum, double our efforts in Arkansas for the summer meals program. And there's some threats. So we talked about the importance of keeping these programs that we know work, keep them alive, keep them well-funded, and to the extent we can, try to continue improving them. For SNAP, that means increasing the benefits. If there's one thing that should happen in SNAP, I don't care what anybody says, the one thing that should happen in SNAP is the benefits should increase. That's what reduces hunger. That's what reduces poverty. So all the other proposals around SNAP don't affect many people and don't have a big impact at all. Raising benefits does. So there's two things happening. There's a budget process. So Congress every year fails to follow the budget process, and then they have a big, almost government shutdown, or maybe a government shutdown. You probably heard a little bit about the president's budget being really bad for programs for low-income folks. The good news is, the president doesn't have a whole lot to do with the budget process. So the budget process is a construct of Congress. Any year, whether it's a Republican president or a Democratic president, he or someday she sends over that budget to Congress. It was called the skinny budget this time around. Remember that? The old skinny budget. So, and then the members of Congress take it, and then they throw it in the trash, and then they get to work, right? They hardly look at it. So, but the budget proposal that's going to come from the House, probably next week, is going to have a $10 billion cut to the SNAP program. Okay, so that's the one program under threat. Earlier versions of the House budget had a $150 billion cut to the SNAP program. The reason it's gone from that big number down to a smaller big number is because people's voices were heard. Not my voices, right? I mean, I'm there all the time. They don't want to see me walking around telling them what to do. They want to hear from real people doing real work, trying to help SNAP participants, talking about their job. So the budget, and then there's the Farm Bill. The Farm Bill's the piece of legislation that authorizes the program. It gets reauthorized every 5 years. It's up. They'll probably try to start voting on it next fall. We'll start seeing language about what they're intending to do the program coming up. There'll be some things that are designed to save money, plain and simple. And we'll have to watch what happens and make sure that we say no to any cuts in SNAP, because you see how important it is to the people and to the economy. So that's the bad news. So we've got some good news, we got some bad news, but the important thing is, what does it mean for you? What do we do about it? This is no good to know about senior hunger and child food security rates unless we know what to do. So, I created a recipe. Does anybody, so if you get your handouts out, so in the back of the sheet with the numbers, there was a recipe, right? So raise your hand if you've got a favorite recipe. I mean, everyone's got a favorite recipe, right? And who knows the ingredients in your favorite recipe? All right. Who knows what to do with the ingredients? Okay. So ending childhood hunger, it's a recipe. We've got the ingredients, and now we've got to know what to do with them, right? So I wrote out a recipe. The way that people make, peachy chicken or barbecue in Texas is a little different than Arkansas. Let's stick with barbecue. I grew up in Texas. I'm very partial to the barbecue that we had. It's got to have red sauce, smoked brisket. That is what barbecue is. I traveled to North Carolina and they put this vinegar-based pork thing in front of me. I mean, that's not barbecue. I don't even know what to call it, right? So the recipe is going to look a little different in North Carolina and Arkansas and Texas, but it's going to have the same basic ingredients, and we all have to make it good and make it work for the people who are eating in our house. I'm not going to read it to you. Everybody can, kind of absorb it yourself, but I want to highlight three things. Three things we need to end childhood hunger in the United States right now. We need to change the way the programs are operated in schools. Okay, that's what we've been talking about. Right now, we call it alternative breakfast. What we need to do is just call it breakfast. Okay? This is the way you serve breakfast, and it is not in the cafeteria before school. We want high-performing schools. They need high-performing breakfast. So we need to change the way schools do their thing. We need to expand the programs that don't have enough places for kids to eat. Summer, after school, childcare. We need more of all of that, not less. New operators, new sponsors, new churches, new community groups, new food pantries. How many food pantries operate a summer meals program? Okay, 2. How many pantries operate an after-school meals program? 1, 2. Okay, so we've got great models and we've got room to improve. The third thing is we've got to protect through advocacy. And this gets back to where do people eat lunch? I know you've been waiting for that moment. I have. So I'll tell you a story of a place where we kept trying to get the mayor. It was a place where the school reported to the mayor. Okay, it's a fairly big city. And the mayor, when he ran for office, said, I'm going to do breakfast in the classroom in all my schools. And, I know you're shocked to hear that perhaps a politician did not keep their campaign promise right away. We were pretty excited about that promise. So we said, behind closed doors, hey, we'll help you. We'll give you grants. Let's do breakfast in the classroom. Let's make it happen. Nothing. We're busy. Other priorities. So a year goes by. We tried all the nice things behind closed doors, and then we did an advocacy campaign. And what the advocacy campaign was? You know where it started? It started because we knew where the mayor ate lunch. So the mayor ate lunch at, some fancy restaurant all the time. And we talked to the owner and chef of that restaurant about this problem. And when the mayor would go in to eat lunch, every single time, the owner comes sit at his table and say, hey, where are we with breakfast in the classroom? And then we also knew where everybody in the mayor's office got their takeout, right across from City Hall. There was one restaurant, and that lady that ran that, every day she dropped in like a little flyer about breakfast in the classroom, right, in their city. Every single staffer that ate there every single day had to see this thing. Right? And then we took out a billboard. Guess where the billboard was located? Between where the mayor lived and his house. On and on, right? These are simple things about relationships, about messaging, but they work. right? It might not be a mayor, but it might be a superintendent. It might be a principal. It might be the executive director of your food bank that you're trying to get to start an after school or summer meals program. Might be a local pastor, right? Advocacy is about two things. One is it's about relationships, and two, it's about messaging. So when we do advocacy work and when the Alliance does advocacy work, we don't just talk about hunger. We talk about what we think that people want to hear. Some people want to hear about educational outcomes. Some people care about jobs. Some people care about health care. You know what? Hunger is not the top of the list. Every year, the pollsters talk about who does what, who cares about what issue. Hunger is always about 6 or 7. Jobs, health care, education are always top 3 or 4. So know your message, because hunger's the bottom of the Maslow's hierarchy. Nothing good happens unless we have good food, right? Nothing good happens unless we have good food. Your voice has to be heard, because we cannot wait for anybody else. We can't wait for anybody else. They've got to hear your stories. I know I'm running out of time, but I'm going to take about 2 more minutes. So I sometimes bring pictures with me when I'm on Capitol Hill. And one picture is, I don't even think you know this, it's from Arkansas from about 5 or 6 years ago. It was taken when we were here doing summer meals. And it was a picture of kids at a summer meal site so one kid, these are little kids, right? They're like 8-year-old kids. One kid is lifting up the bottom of a fence, and another kid is funneling meals to kids who are literally on the other side of the fence, literally. And they couldn't get around and meet the congregate feeding requirement, so the kids were passing meals. I said, this is why the congregate feeding requirement is broken, right? This is the kind of change we have. I bring that picture. I say, this is a real picture from Arkansas. Pictures, stories, your voice, the voice of the folks that you are with, that is what they have to hear in any way you can lift it up. Because you know who's going to end childhood hunger? Nobody in Washington. Is your state agency going to end childhood hunger? No, they're not. That's not their job. They run the program, but the programs are implemented in the communities. We are at this profound moment in history when we can actually solve a social problem. But it takes us getting out of our comfort zones. You do great work every day, but you've got to do more work and you've got to do different work. We need you to call your schools and ask them how they're serving breakfast. And if they want to do alternative breakfast, call Vivian. She'll tell them what to do, right? We need you to get more people to operate summer meals programs and after-school meals programs. We need you to do WIC outreach and SNAP outreach, and we need you to protect the programs. Nobody else is going to do it. We can each be part of the generation in the United States that ends childhood hunger, but not if we don't get to work today. Thank you very much.